As lawmakers discuss a bill that would create 2 overdose prevention sites, many people debate the impact on communities, a debate that is still split. We go now to ABC 22's Lily Sakaniwa, live in the newsroom with both sides here.
Thanks, Lauren. It's clear that substance use prevention is at the forefront of the state's priorities, but there's disagreement about what are the best practices to do so. I spoke with lawmakers and businesses about their thoughts on the new bill and how, if at all, they're hoping to see it impact the Green Mountain State. Almost 100,000 drug-related deaths occurred in 2022, a new record high according to data released from the Center for Disease Control. It's an issue on the rise nationally, and last Thursday, the Vermont House passed legislation that would allow the creation of 2 overdose prevention sites in the state.
This is the time for us to really do this research. This is an evidence-based approach and one that we desperately need here in Burlington.
Reporting from drugpolicy.org says research demonstrates overdose prevention sites reduce overdose deaths, increase connection to health services, and improve public safety. Despite this, however, not all parties agree with the approach.
Currently at this time, the state of Vermont does not have the substance abuse and mental health continuum of care infrastructure in place to support this harm reduction model.
Representative Eric McGuire of Rutland is currently the director of a transitional housing program in Rutland City and has worked with individuals as a drug and alcohol counselor. He worries the bill, if passed, will have unintended consequences.
The idea is to help expedite that individual directly to treatment. And if we don't have that infrastructure of care in place, it's bound to doom.
McGuire emphasizes the lack of treatment resources currently available in the state, highlighting the necessary expansion of treatment, recovery, and monitored detox beds, and the workforce shortage in the human service field.
We got to invest into the proven strategies that are effective, that save lives, and most importantly, bring our loved ones home to us safe, stable, and healthy.
The $2 million pilot project would produce one site in Burlington and another in southern Vermont. The bill was introduced as those in the Green Mountain State have increasingly been seeing its effects firsthand. Tuesday, a passenger riding a Green Mountain transit bus from St. Albans to Burlington found a used needle on the floor behind some seats.
Some folks will attempt to use on our buses or at the transit centers, and it's definitely something that we're aware of.
Clayton Clark, general manager of Green Mountain Transit, says drug use among passengers on their vehicles has been an issue.
And my guess is that they're doing that because that is the only place that they have available.
The bill is now in the hands of the Senate Health and Welfare Committee for review. If the bill is passed, Vermont will be among the first states to allow overdose prevention sites, along with Rhode Island and New York. Worth noting, however, is Governor Phil Scott's continued opposition to the bill, saying, quote, "I just don't think that a government entity should be in the business of enabling those who are addicted to drugs that are illegal," end quote. Live in the newsroom, Lily Sakaniwa, ABC 22 News.